At one point, I realized that as I was working with clients to develop coping skills, that really what I was telling them is you're always going to have to deal with these difficulties. So you're going to have to learn how to cope with them. Well, you know what? That just did not sit well with me. Today, I'm going to do my very first insights with Dr. Becky. This is my exciting opportunity to share some personal perspectives and, of course, some professional insights that I've learned from my work with clients just like you. One of the very first things that I discovered as people walked into my office, they often had a story to tell, and they were typically going through something that was very difficult. Sometimes it was situational, and sometimes it was very, very long term. The common classic thing that most counselors will do is develop a treatment plan. Most of the treatment plans involve developing coping mechanisms or coping skills, as we would often call them, to help people through what they're going through, which makes sense, right? Of course, we need some coping mechanisms when we're going through some difficult things. At one point, I realized that as I was working with clients to develop coping skills, that really what I was telling them is you're always going to have to deal with these difficulties. So you're going to have to learn how to cope with them. Well, you know what? That just did not sit well with me. So I really changed my vocabulary, which of course also changed my perspective. I stopped with developing coping mechanisms. I do know sometimes there is a place for that. But most of the time, we can work on thriving and flourishing. And it was wonderful because I really started seeing my clients being able to do just that. I'd like to give you a couple of examples. This is an example of sometimes how we have to change situations. Clients I worked with had a very toxic friend, and at first she really tried to reframe her thoughts about her friendships and worked on creating additional new positive connections so she would have more friends, eliminating her guilt about her one friend. And that resulted in her having less stress and feeling much more happiness in her social life. And so I think that's really important to recognize is that we can change our situation. Sometimes we can't change our situation. We can change our feelings, our thoughts, and our emotions about the situation. Last example I want to share is people with chronic illness. It's not something that you can change, but if you focus on things that help you, like regular exercise, eating, doing activities that are joyful, working on changing the negative thoughts by doing things like gratitude journaling and affirmations and being more engaged, that can lead to great improvement in your mood overall and actually life enjoyment and fulfillment. So it shifts the mindset from just surviving to actually striving for excellence, striving for change, striving for something better, not just coping and dealing with the difficulties in your life. So that's one of my first insights that I learned. I hope that you can take it and apply it to your life too. Thank you so much for being here with me today.